Today we're going to talk about infection and how to manage that with cannabidiol, or at least the roles that cannabidiol can play with infection. There's a number of different pathways and mechanisms that involve CBD and where CBD can be dramatically effective in a number of areas. And so we'll go into some of those things, and I've got a couple examples for you. Our agenda is going to talk about the burden of disease, the conventional cause and treatment, endocannabinoid deficiency, and the evidence for CBD's benefits. We'll talk a little bit about the serving sizes, and we'll have a question and answer period at the end. When we're talking about the burden of disease, it's really hard to get a handle on this. For instance, we know everyone here and is going to have an infection of some sort, whether it's a viral infection or it's going to be a bacterial infection of some kind, or even an overgrowth of bacteria that will occur sometime in the next year. Some will have some very serious problems. But for those people who die of infections, we're talking about probably 10 million deaths worldwide. And you can see the concentration in the map into Africa, where most of those deaths occur due to infection. In the United States, it's estimated that we have about 200 deaths per million people in our country, in the United States. Not a huge amount, but significantly more than what's being reported in the countries that are around us, and significantly more than what is being seen in Europe. In a total, if you'd estimate that, we're seeing about 600,000 in our country. Total cost estimated at $30 billion for infection. But that doesn't include the sequelae from infections that have not gone well. You know, a big portion of those infections that do occur in the United States are serious infections. And we're talking about 99,000 people who die from hospital-acquired infections in the United States every year. Fortunately, that number seems to be going down or holding about the same. So we still have got a lot ways. We still have a long ways to go in terms of correcting for that. But most of the time, those are hygienic practices. In terms of the world epidemics, if you look at the year 1350, the plague killed probably 100 million people throughout Europe. And then in 1918, we had the influenza epidemic that killed 50 million people, and many of them in the United States. Probably the latest epidemic was the HIV infection, which killed 7.8 million people worldwide. A huge number, and of course, that decimation is still continuing. So it hasn't been completely exhausted. My point is that infection is a huge problem within the world, and it creates a great deal of suffering. Even if there's not death involved, there's a great deal of disability and impairment and a great deal of expense that's involved with it. When I talk about infection, I'm going to be talking about these general topics. So we're talking about bacterial, viral, spirochetes like Lyme disease. There are other spirochetes, but we'll just mention Lyme disease. There are parasites that we encounter, for instance, malaria. And then there is something that we call prion disease, which is actually an infectious particle that doesn't have any biologic or capability, but in fact, it's been found in a number of situations. Mad cow disease, scrappy. There is thought that this is involved with Alzheimer's disease because the particular tau particles seem to be promoted and promulgated in the brain. The same is true for ALS, where we have an abnormal protein that is reproduced and is accumulated in glial cells within the brain. It could be a factor for a prion type of illness that is going on, and perhaps one of the causes for dementia. Whenever we're talking about infection, we're also talking about the immune response. I mean, it's very clear that you can't control infections just by using antibiotics. The body's involved with that very much in terms of the immunologic reaction. And that's a big theme of what I'm talking about when we're talking about infection, because it depends on how the body responds. Certainly the immune response is there, but it needs to be a balanced response, one that defends the body but doesn't overreact to create its own situation. Unfortunately, that's what we see in a lot of conditions where the body has overreacted, making the situation actually worse. Some of these infectious organisms or even prion disease are not bad in and of themselves, but they are bad because of the inflammatory reaction that occurs. I think a perfect example is the viral type of lesions, the HIV, where you have an impairment going on with a particular cell type that makes people vulnerable to other types of infection, and you have an immunologic depression. There's many other viral illnesses that reduce immunity, but they also create an inflammatory situation within the body for which many of the symptoms are coming from that inflammatory situation that has arisen. Now, the pathways of disease, I mean, these are pretty classical in terms of the invasion and then the defense response, and then the immunologic response is where I need to focus. Certainly, the bacteria and the organisms produce a toxicity to certain cells, and they cause some tissue damage. Well, when that tissue damage occurs, it seems to expose certain proteins that are not normally exposed, and the body, not knowing how to interpret that, seems to develop an immunologic and antibodies to some of those proteins that leads to targeting some of those specific tissues and the autoimmune type of reactions that can occur in some cases. Now, the conventional treatment is support. Helping the body get through it. As I mentioned before, the immunologic response is what's there to kill off the organisms, to control the response, and to go through recovery. And so support in terms of fluids, in terms of helping people manage through the symptoms, I mean, those things are vitally important. And then we are relying on, in this country, more and more in terms of antibiotics, antimicrobials, dealing with fungus and some of the parasites and those other organisms that we're encountering. And we're trying to work through those particular things, but the real emphasis and the real point that we don't have many useful agents for, and that is immune. Now, we have useful agents that suppress the immune system and block it, but that's not any good for infection. That actually can lead to the promotion of infections and being a compromised host, so that organisms that normally don't invade the body are now invasive and produce quite a bit of disease. So the emphasis here is in the possibility of something like an endocannabinoid or a cannabinoid or phytocannabinoid working as in a role to enhance the endocannabinoid system and the ability to modulate this type of infection. Certainly, we do have significant evidence for endocannabinoid disturbances in infection. Typically, they occur after the infection has been going on along a while, where you have excess cannabinoid type 1 receptors, you have deficiencies of anandamide and 2-AG, and you've got increased inflammation as a result of the number of CB1 type of receptors, and then the immune regulation by the CB2 receptors. All these things are in disorder with chronic type of infections that go on and persistently if they are not managed well. The direct effects that cannabidiol has on the pathogens is quite remarkable. There's clearly evidence for the antibacterial effect on staph and on strep, and particularly MRSA type of infections, where cannabidiol has a significant antibacterial effect on these organisms. In addition, with regard to viral illnesses, there is some really excellent evidence for cannabidiol specifically in hepatitis type C, where it reduces the number of viral organisms significantly, 84% in the first exposure to cannabidiol after in laboratory experiments. So Then you combine that with the potential in like hepatitis C of reducing the inflammation and the fibrosis, and you've got a substance that's working on two angles to reduce the impairment and the organ damage that occurs in that viral situation. And then we have the anti-prion type of proliferation. That's could be one of the mechanisms involved with the ability for cannabidiol to block the progression of some of these neurodegenerative conditions, particularly Alzheimer's disease and ALS. Some great potential for these areas. CBD affects the immune system in a number of ways specifically, and this is the real jewel for cannabidiol, where it's modulating the immune system so that we can protect the body from the overreaction that occurs. Cannabidiol is working to regulate the immune cell balance, so it's controlling the number of immune cells, it's providing protection from infection and from reinfection, but it's also reducing the number so the inflammation is reduced and the body doesn't overreact. It's protecting organs from damage. So in sepsis and serious infections areas like encephalitis or in liver disease, there's a great deal of inflammation that's going on there that will kill off a lot of normal cells. Cannabidiol is protecting those organs and protecting that tissue from the damage that can occur from those toxins and from the inflammation that's typically associated with it. Cannabidiol is regulating the amount of inflammation, not only by the number of cells, but also with control of the cytokines that are being secreted by those cells. So it's reducing the inflammatory cytokines, but it's raising the number and the amount of anti-inflammatory cytokines specifically. Quite remarkable that this substance has the ability to go both ways. It inhibits autoimmune pathways. So some specific cells seem to be involved with the autoimmune type of process. Maybe it's the exposure to those damaged cell proteins that leads to the autoimmune and certain T cell lines that are involved with that. We're seeing cannabidiol working on those particular T cell lines of cellular groups and reducing the number that they're producing. CBD also has the ability to reduce the ability of the T cells to present those particular antigens to B cells that create some of these antibodies that are involved with the autoimmune phenomena. And another really important point is there's no interference by cannabidiol in terms of the immunologic response to external stimuli. So if you get a bacterial infection, it's not preventing the body from responding acutely to those infections with the immediate responses that the body has. Here's a good example of a serious infection and the consequences of that infection. So Lyme neuroborreliosis is a serious problem that affects about 15% of the population who gets Lyme disease. And this is persistent symptoms of longer than 6 months that are producing quite a bit of discomfort. Some new information is out showing that T17 type of T cells are very much involved with this, and you can actually predict which patients are going to be having a potential for a chronic Lyme disease based on the immune response from those T cells, whether they're producing sustained levels of the interleukin 23 or not. Those people who had that had a tendency to develop either chronic neurologic or chronic arthritis. So it might be possible in Lyme disease to pick up on those. Now, cannabidiol has specific action on the T17 type of cell. There's no specific evidence with regard to Lyme disease, but the regulatory ability that has been established for cannabidiol leads to a promising conclusion that cannabidiol could be effective in controlling many of the symptoms. Now, here's an example of how cannabidiol can be used to reduce an infected wound and restore it and improve the healing process. In this case, we had a wide excision melanoma that subsequently became infected in an 80-year-old gentleman. This gentleman had a weeping wound. He was not being able to be scheduled for skin graft in order to cover that up. I recommended using cannabidiol. They used it around it and into the wound, and within days that entirely cleared. Not only that, we saw the healing rate accelerate on the order of 1 centimeter per week. You get the inflammation out of the way and you're going to advance the healing process. So what kind of doses do you need for infection? It's really hard to say what that is. I recommend starting with the 15 milligrams twice daily as a standard dose for almost everybody in all conditions. And then to adjust and early and boldly to control the symptoms. Now you can target the cannabidiol to control the symptoms, the pain, the discomforts that is there. For those serious problems, you're certainly going to need to run the doses up much higher. Usually we think in terms of oral dosage, but if someone is impaired and they're not able to take things by mouth, it may be useful to use the cannabidiol topically, extending it over any body surface area widely and allowing them to get significant absorption through their skin and quite effectively. The different forms of cannabidiol, there are many different forms, including now there's a potential for vaporizing cannabidiol in a formulation that has recently come out from Elixinol. Typical duration of action is 6 to 12 hours. There's wide variations on that. For someone who's infected, I would use that, but I wouldn't hesitate to move to 3 times a day if that helped with the symptoms. I'd let the symptoms of the patient be your guide in terms of the effectiveness. Certainly once you get the symptom response, you're getting the effects all over the body and you're going to get the benefit for controlling infection and inflammation. Now, who can cannabidiol be used for? Certainly not everybody who gets an illness needs to be taking cannabidiol, but you should really consider cannabidiol for those serious problems where there's toxins that are at high risk or high levels, where somebody has an impaired organ function like a kidney or a liver. And then if somebody has really maximized their support and needs to maximize their support and protection, somebody who's in a difficult situation. Certainly, and you have the other symptoms of pain, analgesia, and just well-being and improved sleep. Some of the other conditions we got to think about using cannabidiol where it could be quite valuable would be those of sepsis, major viral infections like hepatitis C, herpes infections like zoster, and encephalitis. Now, one of the recommendations and suggestions has been that cannabidiol could play a major role in controlling some of the sequelae of Ebola. A lot of people don't realize it, but Ebola, in terms of their chronic symptoms that occur as a result of Ebola, not just the high risk that can occur with Ebola and the death, those that recover are left with a number of problems. And cannabidiol could be the solution for that and even be helpful during the acute phase. And of course, there is HIV disease where cannabidiol has been shown to be highly supportive and protect. It's very clear that infection is a huge burden of disease for the whole world population, especially with new epidemics that are coming on. CBD addresses the serious pathways that are involved with infection and the inflammatory pathways. CBD is supported by preclinical studies and practice situations for many conditions that should allow us to move on to some of the more serious conditions that there have not been studies that are done. In many cases, those studies are going to be 10 or 15 years before their completion. It may be a time to use cannabidiol in those serious situations for which we do not have good therapy. Example, Ebola. There's no adverse side effects significantly or toxicity or significant drug interactions using cannabidiol. So it's safe and it can be extremely effective. I've put references, slides, notes into this Google page, and this is going to be available to you immediately so that you can take a look at this, review the material, and use it as a resource for yourself.